Okay, in session 11, we are going to again look at gastrointestinal care part 2. And in this, our topics, or the topics we are going to discuss are gastric suction and lavage, gastrostomy feeding as topic 2, ileostomy and colostomy care have already been taken care of. And for your assignment, you are to revise Blakemore tube and ballon tamponade and hot sitz bath, which were discussed in NURS 337. Our gastric suction and lavage is our first topic. Gastric suction, commonly known as stomach pumping, is a procedure done to empty the contents of the stomach, and it's quickly done during an emergency. The gastric lavage is also commonly called stomach wash or gastric suction, and is the process of cleaning out the contents of the stomach. It is used for eliminating poisons from the stomach. It's also done to collect a sample of stomach acid for tests, to suction out blood if a stomach hemorrhage occurs, to relieve pressure on blocked intestines, and to clean out the stomach before an upper endoscopy is done in a patient who has been vomiting blood. It is, however, contraindicated in patients who are at risk of hemorrhage or gastrointestinal perforation, patients with loss of airway protective reflexes, such as patients with depressed states of consciousness. Before a lavage is done, an esogastric intubation is done. Gastric and intestinal intubation is the process of passing a tube through the nose or mouth, through the esophagus and into the stomach or intestine. And the patient is intubated for one or more of the following purposes. For the purposes of washout, as we've already said, to obtain specimen, to relieve distension of the stomach or intestine, or keep an obstructed bowel empty. Now, the suction is done by means of a mechanical drainage apparatus, which may be ordered by the physician. And these devices are designed to provide controlled low-pressure suction to avoid injury to mucous membrane. The procedure is a responsibility of the nurse to test the suction equipment by aspirating water through the drainage tubing, and then it is then clamped. Then the nasogastric tube is connected to the drainage tubing, and both the drainage tube and the nasogastric tube are unclamped and observed for drainage in the tubing. The patient moves or turns. The procedure must be explained to the patient. Then we also need our equipment for the procedure. And the equipment for the lavage include syringes or two or more syringes, that is a large gauge needle, 50 cc needle, wash basins to collect used solution, bath towels, we have pads or gauze pads, immersive basin, tissue paper, graduated container for measuring, prescribed lavage solution, and then suction equipment. So after checking the equipment, the procedure is explained to patients. Patient's bed is protected, and then the large gauge needle is used to draw a large amount of fluid, saline or distilled water, and it is connected to the nasogastric tube, which has already been passed, which in turn is connected to a receptacle or a drainage bag. So the washout is done until the returned fluid is clear. Patient is reassured whilst carrying out the procedure. Remember, vital signs are supposed to be checked before and after the procedure. The passage of the nasogastric tube is not comfortable, so patient needs words of reassurance, and patient is asked to remain still and calm. And when the tube is being passed, patient is also instructed to keep swallowing so that it will be able to pass through the normal channel. The tube is tested for placement before introduction of the tube for the washout. After the procedure, the trolley is discarded, patient is made comfortable, and then recording of the procedure is done in the nurse's notes and the report book as well. We also have the intake and output chart, and it should be recorded in the intake and output charts. Now our next topic is gastrostomy feeding or lavage. Note the difference. The washout is known as lavage and the lavage is feeding. Gastrostomy feeding is an enteral tube feeding whereby liquid nourishment is provided through a tube permanently inserted into the stomach through the abdominal wall. It's a means of providing nutrition for a patient who cannot consume food normally. Patients may have difficulty with chewing or swallowing, or an oral, pharyngeal, or esopharyngeal deformity. We have two types of feeding. We may feed patients through a Foley's catheter, that is Foley's catheter feeding, and then the Malicot pull-down feeding. And it's also indicated in cases of complete obstruction of the esophagus, either by a stricture or a tumor. And then preference of tube feeding will depend on a number of factors, including expected duration, the condition necessitating the feeding, and the clinician's preference. Now, the percutaneous endoscopic gastrostomy tube is the most common method for tube insertion. And in this, it's also known as PEG. The tube is placed using direct endoscopic visualization through an abdominal incision. It is then anchored in place with an outer flange and an inner bump or balloon. It then enters into the abdominal wall into the patient's stomach. So it is also invasive, and the incision is made through the abdominal wall to the patient's stomach. Then, to be sure of tube placement, an X-ray may be taken, and a gastrostomy button is at skin level and it's out of sight when the patient is clothed. So patient is left with a small button which serves as the channel through which the feed will pass through. So this button will replace the gastrostomy tube for weeks before the tube is inserted to ensure that it matures. However, the PEG is contraindicated in pregnancy, diabetes, people with allergies, heart and lung conditions. Now, our nursing management. The nurse has to assess nutrition and hydration status of the patient, monitor and observe for signs and symptoms of aspiration pneumonia, gastrointestinal complications such as bleeding or peritonitis, and ensure that patient stops taking medication such as blood thinners, warfarin, and other anticoagulants. Now, all these are types of feed that can be introduced through gastrostomy feeding. We have milk-based solutions, soup, low residue feed, and then we also have tea, Milo, and the methods of feeding include gravity flow, drip regulated, and with gravity flow, the feed is allowed to flow by gravity. We have a special bag and special syringes for feeding purposes. Then the drip regulated one, which is also hanged and regulated and allowed to flow slowly. And then we have the mechanical pump feeding, where we mechanically push the feed through the incision or the site for the feeding. So we need to ascertain the type of feed, determine the amount of feeding within 24 hours, Then a tray should be set and sent to the patient's bedside. Privacy is provided, and then the patient is positioned preferably in the right lateral position, because the stomach is found at the left side of the abdomen. Then placement of the tube is tested, and this can be done by use of a litmus paper. And because a litmus paper may not be common, it can be done by aspirating amounts of fluid, and then we check if it's a gastric content. Then the feed is prepared or made ready. The feed is attached to the feeding apparatus aseptically, and ensure the clamp is fixed. When the feeding apparatus is being filled, a clamp should be fixed. Fill the apparatus to about 3/4 full. It is then unclamped, and then the apparatus is left to enable the content flow by gravity into the patient's stomach. Just before the feed finishes in the syringe, we add more to avoid air from entering the patient's stomach. The tube is clamped just before the feed finishes. It is unscrewed and disconnected and spigoted, and then the patient is kept in position of feeding for at least 30 minutes, and this encourages gastric emptying. Then the tray is discarded, wash hands, and then we record the amount of feed. This should be recorded both on the nurse's notes and then the intake and output charts. Observe the client for discomfort, vomiting, and pain after the feeding. And specifically, as a nurse, you should try to eliminate unpleasant odor by changing the syringes regularly, cleaning the sites regularly, and then ensure the personal hygiene needs of the patient is taken care of. Provide oral-nasal care. We also monitor fluid and electrolytes balance, and hence the need for the intake and output charts. And then we should remember to ensure aseptic technique and general cleanliness of all items used. So that brings us to the end of this course, NURS 352, Advanced Clinical Nursing. So for your reading list, you are to read Bear, Smelter, Henkel, and Shiva in Buna and Sadat's Textbook of Medical Surgical Nursing, 12th edition. And then for your assignment, as you go to the wards, you are expected to identify patients who are in need of these procedures. You are expected to set trays and trolleys for these procedures and assist the doctor carry out these procedures. And you should be able to provide effective and efficient nursing care for patients undergoing procedures of the integumentary, respiratory, cardiovascular, gastrointestinal, and genitourinary systems.